Okay, good evening and welcome to General Council of May 25th. First, again, would like to welcome each of you to our General Council meeting. I hope everyone had a relaxing, long weekend. I know it was a little different without bread and cheese, but we do have plans in August to still have it when it's more safer for our community to do so. So that being said, I hope you had all a great and safe weekend. I first want to begin with any identification of any media on the line.
Victoria Gray from the Turtle Island News.
Good evening, Victoria. Are there any other representatives from the Two Row Times? Okay, seeing none, I also want to say nyawa and acknowledge Amber Squire for opening our meeting this evening rather. I'll then now go to any changes, additions, or deletions to the agenda. I see Michelle.
Can I just add, I had a community member who had some damage done to her vehicle, so I just wanted to bring it forward. And I'm sure Mike will handle it as he's aware of it. So I just wanted to bring it forward to make sure it was dealt with.
Okay, thank you for that, Michelle. Is there anything further? Okay, that being said, can I then get a motion to adopt the General Council agenda? Moved by Michelle, second by Audrey. Are there any questions, comments? Seeing or hearing none, all in favor? Any opposed? Seeing or hearing none, the motion's carried. We do have a delegation this evening. Sarah Smith is going to be joining us, or is joining us rather, to speak on the vaccine data specifically to Six Nations and where we're at, as well as our vaccine clinic and the utilization in our plans moving forward. So really just the data that's backing up and the decisions that have been or are going to be made in relation to vaccines. So just want to welcome Sarah. I know it was a really good presentation last week at our emergency control group, so I thought it'd be very valuable and beneficial for Sarah to join us this evening and to present to full council as well as our community. So that being said, welcome Sarah and good evening.
Good evening. Thank you for having me.
Yes, no problem. So I'm going to just pass the floor right to yourself, Sarah, and then maybe if there's any questions, we can just hold on the questions. It's not very long presentation, and then we will look to questions after Sarah's presentation. So Sarah, you have the floor.
Okay, thank you. So good evening, everyone, council, chief, community. My name is Sarah Smith, and I'm the epidemiologist at Six Nations Health Services and the planning section lead of the incident management team for the pandemic response. So before I get into my presentation, I will just provide some information on what I do. So epidemiology looks at patterns and factors which affect the health and well-being of a population. So my role is to look at factors which affect the well-being of Six Nations community members, as well as monitor health outcomes of Six Nations community members. So as most epidemiologists at this time, my primary focus has been monitoring COVID-19 in the community and evaluating the level of risk of transmission, the capacity of our community health system responding to the pandemic, which includes the assessment center, public health capacity, and our EMS, as well as what is occurring in our surrounding area. So today what I'm here to present is the utilization of our vaccine clinic and some key findings from evaluations that we have done within the community. So beginning May 1st, Six Nations of the Grand River began increasing access to first doses of the vaccine to community by holding a 2-week vaccination blitz of first dose clinics. So what I will be presenting today is Six Nations Grand River current vaccine coverage as of May 21st for first doses, utilization of the mass vaccination clinic and call center, as well as providing results from various engagements, which include vaccine clinic evaluation, the community survey, and vaccine education post-evaluation. Number one, Six Nations community vaccine coverage. So due to the complexity of data on Six Nations, some people have been vaccinated off reserve, some have been vaccinated on reserve. In addition, the provincial databases do not track who is a band member and who isn't. So for us to track vaccine coverage, we utilize two data sources. So we do this through the Institute for Clinical Evaluative Sciences. So this organization uses data collected through the Ontario healthcare system. So essentially, every time you use your OHIP card, data is tracked in a provincial database. This allows health units and municipalities to monitor health outcomes, service utilization, and basically the needs of the population. Through these databases, however, we cannot identify who is a Six Nations band member and who is not. So through a Chiefs of Ontario data governance agreement, First Nations communities can access ICES to ask their own research questions or get information regarding health of their members. So in terms of vaccine, this allows us to provide us with numbers and demographics of community members who received at least one dose of the COVID-19 vaccine off reserve. There is a reporting lag due to the way data flows of 1 week, and it does not capture Six Nations members who received a COVID-19 vaccine outside of Ontario. Our second source is our own internal tracking at Six Nations COVID-19 vaccine clinics. So this provides us with numbers and demographics of community members who have received at least one dose of the COVID-19 vaccine at our Six Nations clinics. So this slide is just explaining the vaccine coverage calculation. So essentially, I take ICES reporting of band members who received at least one dose off reserve and add that with our internal tracking of band members who received at least one dose on reserve. You take that total, you divide that by the total band membership, or if we're looking at only on reserve coverage, I take that by on reserve band membership. So this is based on the land and band membership office numbers as of 2020. So this graph here is showing vaccine coverage for total band membership and on reserve band membership as of May 21st. So as you can see, total band membership, we're currently at 31%. Our on reserve band membership, we are at 30%. So another question we have when we're looking at vaccine coverage is who is getting vaccinated? So in total, across all of our clinics at Six Nations from the beginning, 79% of doses administered are Six Nations band members, with 21% doses administered to non-Six Nations band members, but who live or work on the territory. Vaccine coverage rates are similar for males and females, as well as on reserve versus off reserve band members. But as you can see, the differences we see with vaccine coverage for on reserve band members increases with age, reaching a peak of 65 to 84. So vaccine coverage is highest in that demographic, and unfortunately 85 plus, we have the lowest vaccine coverage with only 5% vaccinated. So strategies to increase uptake in the community should focus on the younger demographics and identify why there is a low uptake among 85 plus. So the second section looks at vaccine clinic and call center utilization. So what is the demand for first doses of the COVID-19 vaccine? The graph over here shows a steady decline of the number of COVID-19 first doses that have been administered at Six Nations COVID-19 vaccine clinic. The orange line signifies our start of the first dose blitz. The current staffing model can accommodate 457 vaccinations per day. And on average, during the 2-week blitz, the COVID-19 mass vaccination clinic was operating at 13% capacity. The line at the bottom represents the number of walk-ins. So on May 5th, we began opening the first dose clinics for walk-ins. And as you can see, there has still been a low uptake regarding walk-ins. On May 13th, there was an uptick in the number of walk-ins at the vaccine clinic, and this is directly correlated with the Facebook Live vaccine education session. However, most of those walk-ins were people getting their second doses who had missed their second dose appointment. So what is the demand for the vaccine call center? The vaccine call center has reduced hours to Monday to Friday, 9 a.m. to 4 p.m., and this was due to a decreased demand. From May 3rd to May 7th, the call center received on average 25 calls per day. May 10th to May 16th, the call center received on average 21 calls per day. So when is the demand the highest? So most calls are received between 9 to 12 p.m. So that's this graph down here. After 2 p.m., number of calls received significantly declines with very few calls in the evening. What day is the call center busiest? So May 3rd to May 7th, the call center was busiest at the beginning of the week and declined as the week went on. May 10th to May 16th, after Thursday, calls significantly declined with very few on the weekends. The reasons why people are calling the call center, so most are calling to book a vaccine, 37%, inquiring about eligibility, that's 19%, or they've missed their second dose, that's 17%, with the rest making up general inquiries regarding directions, information about the vaccines, or changing an appointment time or date. Other data notes, so May 2-4 weekend, our second dose vaccine clinics have had a low uptake. So May 20th, we only had 40% returning for second dose. May 22nd, we had 41% returning for second dose. So typically outside of long weekends, we have a good uptake of people returning for their second dose. Section 3, strategies to increase vaccine uptake. So what has been done to increase uptake? So these strategies are what we have currently done to increase uptake in the community. So vaccine education sessions, we've had 8 pre-registered Zoom sessions. Those have been available to Six Nations of the Grand River employees, as well as the last 2 for community, 3 Facebook Live sessions, and 2 radio show sessions. In addition, the vaccine clinic dates have been advertised using multiple methods. These include newspaper, ads, radio show, social media. We have also opened the first dose clinics to walk-ins, and we have provided infographics and podcasts shared to social media to discuss the safety of vaccines, as well as the importance of getting vaccinated. And lastly, continuous quality improvement of our vaccine clinics through ongoing evaluations. So we provided the opportunity for community to give us feedback regarding the Six Nations vaccine clinics, and we made changes accordingly. So this section is the evaluations and survey results, the key findings. So number 1, vaccine education evaluation results. So vaccine clinic evaluation results. So for those who have visited our COVID-19 vaccine clinic at Emily C. General and Gaylord Palace Arena, who consented to receive follow-up communication and provided an email, they were provided an evaluation to complete. In addition, we had posters with QR codes where people could scan and reach this vaccine as well. So these are just some key findings. Most respondents heard about the clinic by friends and family, that's 53%, the COVID-19 website, 36%, and social media, 19%. Those who indicated they heard about the clinic through other methods, 2/3 reported they heard about it through their workplace. Top 2 reasons why people got the COVID-19 vaccine. Number 1 was concern for my health, and number 2, the concern for the health of others. Some participants also noted having COVID-19 or knowing a loved one who has had COVID-19, and this influenced them to get the COVID-19 vaccine. 98% of participants stated they were satisfied with the care they received at the clinic, and 87% stated wait times at the clinic was quick. So a community survey was distributed via social media to learn more regarding community experiences with getting the COVID-19 vaccine and concerns the community has regarding the vaccines. The survey had 167 responses, and those who responded that they were unlikely to receive the COVID-19 vaccine or somewhat likely were asked, why would you not receive the COVID-19 vaccine? So these are the top responses. Number one, concerns regarding the side effects of the COVID-19 vaccine. Number two, wanting to wait and see what happens to others before getting vaccinated. And number three, the belief the vaccine may have been rushed, not enough testing to prove it is safe or effective. So the community survey also asked community members to provide their experience getting the COVID-19 vaccine. So this just highlights some key findings. Those who had been vaccinated noted positive experiences, whether they had been vaccinated off reserve or on reserve. Many noted feeling anxious and nervous prior to getting the COVID-19 vaccine. However, after vaccination, many noted they felt a sense of relief and gratefulness. So one of the comments was everyone was very friendly, professional, compassionate, caring. So this was a common theme that emerged during that. A lot of people talked about how friendly the staff were, knowledgeable and professional. In addition, people discussed the actual vaccine clinic and how fast and organized it was. So the last evaluation is our vaccine education evaluation. So there have been a total of 3 COVID-19 vaccine education webinars and 8 pre-registered webinars. To evaluate education, we have used social media analytics and an evaluation form. So social media analytics found a decrease in the number of peak views. So peak views is the number of people who are viewing the video at once. Most viewed for an average of 1 minute of the webinar. This means most did not view the webinar in its entirety. Social media engagement on the webinar. So engagement includes shares, likes, comments, post clicks, declined across the 3 webinars. So our first webinar had the most engagement. It reached 1,000 people. There were 264 post clicks, 70 reactions, and comments and shares. So in terms of our findings of the education evaluation, 52% of respondents indicated their knowledge had increased by a lot. 68% of respondents found the vaccine education webinar very helpful. 73% of respondents had already had their first dose. 30% who had not received the COVID-19 vaccine stated they would get the vaccine after attending the session. And 67% stated they were still unsure whether they would get the COVID-19 vaccine or not. So what this tells us is vaccine education is drawing interest from people who are already vaccinated and want information for themselves or to help educate / influence others to get the COVID-19 vaccine. So based on this data that has been collected, the following recommendations have been compiled. So number one, increase access to priority populations. These are our elders and our younger demographics. So we could do that through beginning in-home vaccinations, potentially reaching that 85 plus demographic who are maybe be homebound. Number two, increase access of the COVID-19 mass vaccine clinic by targeting the 12 to 17-year-olds. Maintain reduced hours at the call center, 9 a.m. to 4 p.m. weekdays, Monday to Friday, with the offering of voicemail for calls received outside of working hours. Continue with vaccine confidence strategies to increase uptake. So this planning is ongoing. There is a vaccine confidence working group that is continuing to plan initiatives and campaigns. So discontinue the Facebook Live sessions and offer 30-second to 1-minute clips. So shorter information video clips that can be provided. And continue to share others' experiences with getting vaccinated. So through all of these engagements, it was seen that people are influenced by others. People hear from their family. They are influenced in trying to keep others safe. So that is a strategy to capitalize on. Engage employers in community to offer vaccine education or identify strategies to increase uptake. So for example, offering targeted vaccine education sessions or clinic days. And lastly, maintain open communication to the community with ongoing communication with the status of vaccine clinics through a variety of mediums. And that concludes my presentation. So I will take any questions now.
Chief, I have one.
Okay, thank you, Sarah, for your providing your presentation this evening. Again, I'm now going to open the floor up for any questions or comments. I'll now first begin with Councillor Carey.
Yeah, are you going to be offering vaccines to 12 to 17? I know we have Moderna on reserve, but I think it was Pfizer that was approved for the 12 to 17. But I just heard on the news tonight that Moderna is saying that they've had test results for their vaccine for 12 to 17 and it's positive, but I don't think it's been approved yet. So would you be offering, first of all, do we have Pfizer available on reserve?
So we currently do not have Pfizer on the reserve, but I'm going to let Lori Davis-Hill speak to getting that on the reserve.
Scano Seguigo. So yes, I can confirm that we will be receiving a number of Pfizer doses for the 12 to 17-year-olds, and we're just in the midst of preparing a communication to go out to the community, announcing the availability for 12 to 17-year-olds of the Pfizer vaccine. The schedule will be forthcoming as to the dates, but I believe it'll be the first week of June.
Okay,
So the registration will open up in a few days. So the
Mark, it's
the-
Melba.
Oh, sorry, if you could just
Go
continue.
ahead.
Sorry, if you could just continue, Lori. Sorry.
no, I was just going to say, Ashwaubenon Public Health does have the capacity to store Pfizer. The storage has been adjusted, and so they are prepared to receive those vaccines, and the plans are underway. It will be a limited
Okay,
amount
great.
of doses right now. I just want to add that.
Yeah, and just to also add, I know even with on the leadership call this morning as well, that there was discussion there in terms of increasing those doses, Lori. So I know that there is ongoing discussions to, obviously if we could meet, if there's the demand, which we'll probably see in the next few days, and looking to the next steps from there. Melba. Sorry, Melba. Melba, you have the floor. Oh, we may have lost her. I'll shift over to Wendy and then over to Michelle. Wendy, you have the floor.
Thanks, Mark. And thanks, Sarah. That was a very thorough presentation. Very well done. It was mapped out. So congratulations on that. I want to know just basically, I looked at the other documents that we have in the Dropbox. How many on-reserve members have been vaccinated? And how many members in total, on and off, have been vaccinated in total numbers? So those two pieces. And then, I really think I see the recommendations in this moving over to public health. I mean, this has always been a public health matter. Public health should have been in charge of this, the entire thing. That's my understanding of how it works every place else except for here. But I also have that concern of the 12-year-olds and up and how that's going to work with, parents and making sure that everything's in place as well. And I from what I gather, and maybe it's my interpretation of the information, but it seems like we really heavily relied on social media. That's been the main targeted campaign of communication. And I don't know if it's a gap in there and we fell short in terms of that outreach, because we had talked before many things in terms of the door-to-door, in terms of that personal reach out to get people. We talked about the mobile unit, and we heard that that was very difficult, but whether or not any of that has happened. But I mean, if I'm reading the information, like, we are still so far behind in getting people vaccinated, and it's a concern with variants and everything else. So I'll stop there, but that's where I'm coming from.
Okay, thank you, Wendy. Sarah, I'm just going to pass it back to you. For I believe Wendy had a question in terms of numbers.
Right. So in terms of our on reserve numbers, we have 3,780 on reserve vaccinated, and in terms of our total membership, 8,651.
So even without people calling in to say, I got vaccinated in Brantford or Simcoe or wherever they went, you now have the ability to collect all of that information through ICES and other means, right? So this is completely accurate in terms of the numbers.
This is as accurate as it is right now. So with our ICES data, it only includes provincial. So within Ontario, if someone got vaccinated in the United States or outside of this province, I don't have that information.
Okay, thank you, Sarah and Wendy. Michelle.
Actually, if you want to go to the community questions, because my 2 questions have actually been asked in the post.
Oh, okay. So just really quickly, the first question reads, we have been in code black for some time with few to no cases. What is the expectation to move out of black? So this is in response, I believe, to our response framework, and actually had those triggering factors. So Sarah, maybe if you want to speak to those.
Yeah, so in terms of our response framework, what we do is we evaluate the level of risk from week to week. So we have had good indicators for these last 2 weeks. So we've had 2 low risk evaluations for our risk assessment. And what that means is once Ontario is out of lockdown, we would move to red as per our response framework. However, the province has shifted to a different framework. So I'm unclear at this time whether we will maintain our same framework. However, these discussions are currently underway. And if Lori or Chief might want to speak to that further, I will turn it to them.
Perfect. Thank you for that, Sarah. And I know, agreed, and Lori, feel free to add in as well. These are ongoing discussions, as we've just, Sarah's alluded to the fact that Ontario's now changed their reopening plan. So we obviously have to look to some amendments to our own response framework, and if that's the route we're going to take, or if we're looking to even adopt into Ontario's framework. So that's really the conversations that we're having at this point in time. And so that we'll be having more communication to community in terms of what the decisions made out of those tables. Not sure if Lori, if you have anything you'd like to add.
Yeah, I would just add that the framework does keep us in black while the province is in black, and then once they've lifted that, we are free to move to red, but also consideration for the amount of vaccinations that we have on the territory. And like Wendy said, we do need to get the vaccination rates up. So there has been a comprehensive plan that has done outside, in addition to social media. But I think we need to rely on maybe the Moccasin Telegraph to encourage our friends and family to become vaccinated.
Okay, great. Thank you. Thank you for that, Lori. I'll hit over to Melba after I ask this next question from community comes in. Where is the information, and perhaps this is something that Lori could assist in answering as well. Where is the information on vaccine in traditional medicine use? That's a reality here. Are there issues with common use traditional medicines for health and medical conditions?
So in our consultation, with our traditional medicine practitioners, they would want to be informed if someone had the vaccination, but there was no contraindications from their perspective at the time, and they're leaving it to each individual's choice.
Okay, thank you for that, Lori, as well. Are there any further questions or comments from council? I see Helen.
Don't forget me, Melba.
Oh, my apologies. Sorry, Melba.
I've been reading that Ford is thinking about or considering opening up summer camps. Is our ECG committee looking at that? Because I did get a call from the Red Barn wanting to know if they can be open because they need time to plan, so they don't want to see us open at the last minute and then expect them to be ready to go. They need time to plan, so they would like to know if council is at any time going to be opening for summer camps. But I see Ford is talking about doing that.
Yeah.
So Ford's decisions are really based on the vaccination rate. That's their new framework that they're following in terms of summer camps. So we are looking at our current state of vaccinations. We also need to look at what their contingency plans are, because even so, as long as if they're outdoors, what kinds of screening, that kind of thing. So there is an event form that can be found on the sixnations.ca website to submit to emergency control group. So that's what I would recommend that they do. And then they can have a plan that's in place. So if we face another wave or if things turn, that they have a fulsome plan that can be scaled up or scaled back depending on what the status is in the community at the time. So I would encourage the planning to happen, that they submit their plans and that we have an opportunity to discuss them at emergency control group and incident management.
All right.
And just to further add as well, all of these pieces are like ongoing. Like I know that we've had multiple conversations even this morning on the same very topic in relation to sports fields as well. So all of these pieces. There'll be more decisions obviously being made, in the coming days and weeks. But this is all ongoing work as we converse here this evening. Michelle, or sorry, my apologies. I've been missing Melba. Melba. And then Michelle.
Yes, considering strategies to increase the vaccinations, will you be considering accepting walk-ins as well as incentives?
Yes, walk-ins have been available. Vaccinations have been available at the last few clinics. So we must need to do a better job at making sure that the community does know that.
Okay. And what about incentives to increase the vaccinations?
We have not considered incentives at this time. But the incentive would be, as a community, the more vaccinated we are in total, but the more population of our population that's vaccinated, the safer everyone is.
Okay, that's one incentive, but what I'm talking about is incentives like bikes or patio furniture, things like that. I'm sure our businesses would donate these kind of incentives.
I just got to finish this.
Say the first 50 or 100 people, the incentive would be a draw, for example.
It's certainly something that we can take back to our tables and have a discussion about. So thank you for that recommendation.
Thanks.
Okay, thank you, Melba and Lori. I'm now going to shift over to Michelle and then over to Wendy.
I was just going to say, Lori, when you made your presentation, I think, 10 years ago, we talked about getting a bus and going door to door. I think this is really the time that that bus could go out and actually go home to home and gather a lot of information. And I've also read throughout Ontario, they've gone into factories and places, large businesses, right, where they have a huge number of employees. So is that something on the horizon?
Yeah, I mean, I agree. We do have a bus coming, but for now, we need to rely on the paramedics to do that mobile vaccinations for us. And just want to reflect back to Wendy's earlier comment about public health, and she's very correct that the pandemic is a huge public health concern. And very early on in this pandemic, we recognize that Ohsweken Public Health is not staffed at a level that was going to be able to manage the pandemic response here at Six Nations, and so that's why Health Services joined Ohsweken Public Health in the pandemic response.
Okay, thank you, Lori. I think also too, just to add as well, that has happened already. Michelle, I know our members of our team, I believe, worked with major, one of the biggest employers on our territory, Grand River Enterprises, and worked with them to get vaccinated as many of their employees as well. So I know that that's ongoing work that's happening. Over to Wendy, and then over to Helen.
Yeah, that was part of my comment too, to target those large employers that have a number of people, because they also have the younger demographic, and to get in there and we have to move to that, I think, if we're going to increase numbers. But on the opening plan, I'm not sure if we actually have a set plan. I do hear you saying that there's discussion, but how far in advance can we get for the opening plan so that people know? Because we seem to be that we lag behind. It's that delay always. And how can we make this less complicated and less confusing for our members? Grade of black to now the province is moving to something else. Are we going to move to that? Are we going to go with something else? Are we going to stick with the color code? What are we going to do? Are we just going to follow the province? Like, I think if we can simplify some of this as well, it makes it a lot easier. And I think it would be a lot less taxing on the ECG, because there's something to follow. I mean, there's always that level of autonomy in the community, absolutely. But how do we simplify it so it's easy to understand, it's easy to communicate, and everybody knows what's happening?
I completely agree with your comments about planning ahead and being able to give the community warning, I guess not warning, but some hope, I guess, for the reopening. It has not been a week yet since the province announced their plan, and so there has been some analysis of what the provincial plan is. So Emergency Control Group will be discussing that tomorrow and hopefully come back with a recommendation very shortly.
Okay, thank you, Lori and Wendy. Helen.
Yeah, I just wanted to comment to, I think it was Lori's comment that they recognized early on that public health didn't have the capacity to handle this pandemic. I remember right at the very beginning saying that, why are we not getting the federal government down here to bring more people here to help us? And I remember saying that. We need to get on their behinds and tell them, get down here and give us people. We need people to help us. They should have been staffing public health. And public health, and Wendy's right, public health should have been the lead, and the feds should have been staffing them. And I think if that had happened, I think a lot of things might have been different. Lori and Mike, they have their own jobs and they're stressed to the limits trying to do all this stuff. So, and the rest of our staff, all our staff, they needed help and we didn't get it from the feds. So that's my comment, but we are where we are. I just think we might have been further ahead or better off had we got after them to send people down here to help us and to help to work at public health and help public health. And they stole our lead player, Deb Jonathan, took her away from us. So it hasn't been easy. And I know these guys been working hard and I don't envy them.
So just on that, and I'm sure Lori has many comments as well. But I think just as onto that point, you know, as much as we can look to what we should have done, we're still very much in the response. So I don't think we should necessarily focus back on what we should have done, because you know, over the time we have seen the increase of assistance from the federal government, especially with public health, sending out different nurses over time, as well as, you know, why the purpose we decided and made that decision as council in the ECG to partner and bring in members of the Red Cross to assist with our mass vaccination clinic. So, you know, those are just examples as to how we recognize some of those gaps and challenges within our own response at the time, and then had those you know, delivered in terms of addressing some of those pieces. Not sure if Lori, if you'd like to add anything else further to Helen's comments.
No, I mean, part of you know, was our commitment, knowing that health services has such a large staff complement, that we were committed to supporting the response, and public health did manage the first sort of 3 steps of the pandemic response, and when it got, you know, much larger than they couldn't have carried the entire thing, you know, without a number of different staff. So I just want to acknowledge that that the federal government did send supportive staff when we were in our outbreaks, and when our numbers were really high, they sent paramedics, they sent nurses, and so, you know, it really has been a community response. And so, you know, public health has been there guiding us throughout the entire pandemic, and making sure that we are staying on track, as well as our team members who have, you know, their degrees in public health. So we've had a lot of skills and expertise that have supported our response. So, you know, we've done our best.
Thank you for that, Lori, and we'll continue to do our best as well. So appreciate your words. I have Sherry Lynn next, and then I'll move over to Hazel and then Michelle.
Yeah, you talked about the sports fields. I've been getting calls about the splash pad since it's open, the province is open. Any ideas, or what about ours? Our splash pad.
So again, I don't want to comment too much on the specifics, because a lot of these pieces are ongoing discussions happening. So that being said, I just at this point don't want to confirm something that hasn't been fully discussed in terms of planning. So that nonetheless, though, Sherry Lynn, this is definitely on the radar and agenda, and we'll definitely have recommendations and further decisions for community in the coming days. Hazel?
Yeah, I would just like to say that I was also asked about the walking track, the blue walking track, wondering when that will be open. And I think you're right. When there's plans happening, I think they're cautious plans, because this whole pandemic thing hasn't been a very easy experience for any of us or all of the workers who have had to work so many hours of overtime. I think everybody deserves a big, maybe a big picnic in August after all that everybody's gone through. The only thing with this number of people who are not vaccinated, I don't know if people have decided that they don't want that vaccine. And no matter how many times you ask somebody to do that, if they're not going to do it, you just have to let it be. I think the only thing that as a result of not being vaccinated, it might trigger another wave to come, like the 4th one, and hopefully not, because I think we're all at our wits' end wanting this to be over now. because even when you go to shop, you can't even buy anything that you need because everything's roped off. So to those that have concerns about the vaccine, I think there should be maybe a discussion room where people can go and talk about that. If they're afraid, I think all of us, when we got vaccinated, you wonder how is it going to affect you. But I think the feeling that you're protected overrides the fear that you might have when you're on your way to get a needle. So I think everybody's done the best they can. I don't know if there was more work. It would probably still be the same as it is today, the same number vaccinated. So I think if people don't want to get vaccinated, there's not a whole lot of that anyone can do, except maybe if they want to discuss it, maybe be reassured. But I just think everybody's gone above and beyond and working and doing the best they can, and that's all you can do. This pandemic didn't come with any rules to tell everybody how to do it right, so we've had to learn as we go. Okay, thank you.
Okay, thank you, Hazel. And just before I head over to Michelle, I just want to acknowledge, because basically we're having these conversations as well right now. Again, the comment from community is following up with summer activities pending on vaccination numbers. Will there be some sort of summer sports for our kids? Our kids' mental health is crucial at this point and been cooped up for quite some time and need some sort of recreation. So again, we are definitely recognizing and acknowledging, the mental health piece to this pandemic. I think that's what we're referring to, as well as in terms of post-pandemic and what we're currently all dealing with. And so mental health definitely is priority. And so these conversations, again, are ongoing at Emergency Control Group. And again, we'll have further decisions made, and that will be further communicated to our full community in terms of all of our recreation plans and so forth. Michelle?
So I would like to thank Sarah for her presentation. I'll move to accept her presentation as information.
Okay, thank you, Michelle. There's a mover. Is there a seconder? Second by Wendy. Are there any further questions or comments?
It's Melba. I do. How is the ECG going? How is the ECG going to handle the concerns of people who are afraid of people who have not been vaccinated? Is there discussions presently at the table?
So that's actually a tough question. I know that we've had discussion at multiple tables, side tables, I think even as a group, but I know Lori did have to step away, and Mike, our chair, Mike Montour of the ECG is on the line. I'm just looking to see if you have any comments on that piece, Mike.
We're just openly discussing a lot of different things and the impacts of the pandemic and even post-pandemic. So we're doing our best to plan. But right now, that's the whole point of the I guess our alert level black is that people just stay within their households at this point in time because our vaccination numbers are low and that's concerning. So until there's been a lot of great ideas and great things said around the meeting here, and we'll take those back and we'll
Thank you.
get a plan together.
Thanks.
Okay, thank you, Mike and Melba. Are there any further questions or comments? Okay, it's been moved and seconded. All in favor? Any opposed? Seeing or hearing none, motion's carried. And just really quickly, just before everyone or we get off on the next topic, I just want to acknowledge all of our PSWs, as well as Paramedic Week, as well as our Nurses Week. So all of the key stakeholders that have been huge players in our total response to this pandemic. So just want to acknowledge and recognize all the hard work by each of these people in putting their community health and safety first and foremost. So again, just wanted to make that acknowledgement again as well. Sarah, thank you for the presentation and all of your work that you're doing as well. And likewise to you, Mr. Mike. and the rest of the ECG team. So again, thank you for the presentation, and we will look forward to where we go from here. Okay, so our next step here, council, or in our agenda rather, is the adoption of the general council minutes of May 11th.
I'll move.
Okay, it's moved by Sherry Lynn. Is there a seconder?
I'll second.
Second by Carrie. Are there any questions or comments? Okay, seeing or hearing none, all in favor? Any opposed? Seeing or hearing none, motion's carried. We'll now move into recommendations from our ethics committee, starting with recommendation 1. So I will need a new mover and seconder for 1. Or members to speak from the ethics committee on each of these.
I'll move on number 1. And I just wanted to say that, sorry that we didn't have this summary the last meeting. Apparently it went through a couple of hands of council members, but now it's gotten to the third, which is council. So you have a briefing note that was approved by the committee, which you have in your hands. So I will move that number 1.
And I'll second.
Okay, thank you, Melba and Michelle. It's been moved and seconded. Recommendation 1 that reads that the Six Nations Ethics Research Committee recommends to the Six Nations Elected Council to approve Miguel Sil's application to conduct research titled Creating an Urban Indigenous Spaces in Kitchener-Waterloo. Are there any questions or comments? Seeing or hearing none, all in favor? Any opposed? Seeing or hearing none, motion's carried. Look for a mover and seconder for recommendation 2.
So Nathan moved, I'll second.
Oh, moved by Audrey, second by Michelle. Again, that it reads that the Six Nations Ethics Research Committee recommend to the Six Nations Elected Council to approve Colin Gibson's application to conduct research titled Six Nations Water and the Impacts of Water Insecurity During a Global Pandemic. So it's been moved and seconded. Are there any questions or comments? I think that's going to be an important one. Seeing or hearing no questions or comments, all in favor? Any opposed? Seeing or hearing none, motion's carried. Recommendation 3.
I'll move.
Moved by Michelle, seconder. Second by Melba. Thank you, Michelle and Melba. Again, it reads that the Six Nations Ethics Research Committee recommends to the Six Nations Elected Council to approve Colin Gibson's application to conduct research titled Six Nations Response, Highlights, and Tool Development. Are there any further questions or comments to recommendation 3? Seeing or hearing none, all in favor? Any opposed? Seeing or hearing none, motions carried. Is there a motion to waive second reading on the 3 previous motions?
I will, Melba.
Moved by Melba, second by Michelle, again to waive second reading on the 3 previous motions. All in favor? Any opposed? Seeing or hearing none, motions carried. Moving on to the next recommendation from the Building and Infrastructure Committee, recommendation 1.
Mark, sorry, it's Wendy.
Oh, sorry, Wendy.
Just on the ethics, ethics pieces. So we will receive copies of all of those reports, right? That will go back to ethics or back to full council.
That's correct.
Thanks.
Yeah, you're welcome. Okay, so recommendation from B and I. I'll look to recommendation 1.
I move that whereas the Six Nations of the Grand River Elected Council has acknowledged that the Public Works Department is working to provide an additional tree and brush cutting service to meet the community health and safety needs. And whereas the Six Nations of the Grand River Elected Council has approved Six Nations Public Works to enter into a contract with Hydro One for brush clearing and hydro line clearing in the amount of $136,750. And whereas there has been questions from a community business in regards to a competitive process for community service contracts and a concern about lack of policy or procedures. Therefore, be it resolved that the Building and Infrastructure Committee recommends that the Six Nations of the Grand River Elected Council accept the Hydro One contract follow-up as information.
I second.
Okay, it's been moved and seconded. Are there any questions or comments? Wendy.
So I don't really understand what this motion is doing. I see the whereas that it recognizes that there was a community concern, but there's no action to it. There's no response to it. I read all of the documents in the package. I am concerned that the concern coming from the community member and the business is being ignored. And it certainly hasn't been addressed in any of the documents that have been provided. And specifically when I see the corresponding email between Public Works and Hydro One, in one of the questions where it says, if the First Nation takes this on, this contract, can they then engage with a First Nations business? And the answer was yes. So that is not laid out in any of the option. That's not been considered. I don't see it in the motion. And in fact, in the briefing note that was outlined, it speaks completely against that. And it goes on to talk about discussion on developments with other council departments in a like situation. But in that document, it talks about health services, it talks about Meals on Wheels, it talks about the food bank, it talks about the dental program. I fail to see how the comparison between the dental program and services compares to a local small business that's competing against our departments. I mean, the dental program, let's be clear, has been around for over 90 years. And that's a federally funded program, as is Meals on Wheels and a number of the other programs that are listed in there. So I didn't see any of the substantiating documents. Where's the interview? What questions? You know, where are the responses? How was it framed out? How was it mapped out to come to the conclusions that it did, both from the Public Works Department and from BNI? And I understood when this was brought up before, because I brought it up, that the chair of BNI and the committee were actually going to reach out to the small business to have discussion with them and put them on the agenda of BNI so that they could have that. And further, I understood the director of Public Works was going to reach out as well. And when I saw this on the agenda, I reached out to the small business to ask them if anyone had contacted them, and no one did. So there's been absolutely no discussion or dialogue with that small business past April 27th. So I'm wondering why none of that happened and why we're just ignoring this. Because I think it raises a bigger question. Are we, as the elected council and the departments that come under us, are we going to start getting into businesses and taking away from the small businesses that we have in the community? If that's our direction, then I think we need to be very clear. My concern is this: in Public Works, I know there's a lot of staff. I know they work diligently. I know they work very hard. And certainly the roads department, because I see them literally every other week in front of my house patching the road every other week. Our roads are a mess. It couldn't be any more clear with Fifth Line. I mean, I saw Carrie's, 20 emails back and forth about Fifth Line and trying to do something about that and get a meeting with the contractor and follow up. Our roads are a mess, as are the water, all of those things. If we want to invest in a company, instead of taking away from a small business, why don't we invest in a paving company to fix our roads, do the bigger investment? I feel like we're doing these one-offs and we're running after these small businesses, and we are in competition. So why would we not consider, if we take the contract, and I understand it's a done deal with Hydro One, why would we not consider subcontracting with that small business or another small business. There's probably more than one out there. If they're legitimate, if they have everything in place and they can do the work, why would we not promote that? Promote the entrepreneurship in our community. That's the economic base that we should be pushing towards instead of our own departments that are funded federally or provincially. I mean, we're setting our own small businesses up to fail by doing this practice. So I don't know if there's any response, but the first one is, why did no one follow up, as was discussed in the last general council meeting when this came up, to follow up with the business and have that discussion with them?
Okay, thank you, Wendy. I'm going to shift over to Mike Mentor.
Thank you for that question. So I was notified of the last minute agenda item when it was first discussed, and I had to tune in on Facebook Live to watch it because I was trying to get the link, but I couldn't get it sent to me. But what I got from the discussion was the council wanted to develop a policy on when outsourcing occurs, which is why I pulled it out and said, here's all the services that we can provide that we get federal provincial funding for. You know, where's the line for them? Like, what are the impacts of this decision if you're going to say, you know, let's outsource this part, but not these other pieces, because there's a lot of moving parts and a lot of different programs. And really what the focus is on community benefit. It's on building capacity so that we can service as many residents as possible for little or no cost. So that's our focus. And we've been very upfront with the B&I committee to say, we want to develop capacity in forestry because we see a gap. And I know that I've seen emails even from yourself, Councillor Johnson, just in regards to, you know, can we help these elders with their tree cutting or tree trimming? And it's just a matter of trying to say, I want to get into a position where I can say, yeah, we have that service internally. We can do that. Or we can leverage, you know, we can leverage Ontario Works funds. We can leverage social services funds to get this done for the community at little to no cost. So that was the whole intent on pulling it out like that and making sure that we're informing if there's going to be policy development, that line is clear and those impacts are well understood so that a good decision can be made.
Can I ask?
Okay, I'll allow a subsequent question from yourself, Wendy, and then I do have other hands being raised.
So I just want to be clear. I actually brought this forward and it wasn't to develop policy. That's not what the issue was. It was brought up because a business owner went to you, Mike, and had a discussion, and also had a discussion with one of your staff and asked about direct competition due to subsidized resources. And they were told, yes, it was a direct competition with them because their rate would be higher as a small business and that you could charge a lower rate. So we've got a company that has 10 years of forestry experience and 40 years in construction trades, but we're not allowing them an opportunity to work. And I hear what you're saying about providing service to the community. Absolutely, there's a need because we can't find enough people to do it. So how do we maximize that so that there's options and there's choices for people to do that? And if we're talking about Ontario Works and we're talking about other programs to subsidize, why would we not do that through our own businesses to help subsidize that and share that so that we can service even more? Why would we hold that to ourselves and be a bit territorial about that and then not allow an expansion of that? It doesn't make sense. We should be doing the opposite. If there's subsidy, then give that out to the small businesses so that they can do it. It's a startup for public works. And my concern is that here we're running over in this direction. Public works is huge and we can't keep up. And that's what I hear being reported from you, Mike, and others. We can't keep up to the work that we have. So why are we going after yet another avenue to do something? And when you brought this to council to get that passed, I specifically asked if this was a money-making venture, and you said yes, because it would make money. Because I said, why are we buying this equipment? So it wasn't for community service, it was to make money for public works. So we need to be very clear on this and what the direction is on this of what we're doing. So I think there's other avenues, and I don't see the options in the motion. I don't see the options coming from B&I. Why would we not expand that out? And it's not just this company, but it's many other companies within our territory that's being impacted by this. And I say again, why would we not invest in paving. I mean, we saw the mockery on social media about the lines in Oshwegan. I mean, the work on our bridges, we're constantly dealing with these outside companies, and we're paying millions and millions of dollars to outside companies to do this work. Invest in a paving company. That will do us well. Like, I don't understand the strategy and the direction with this.
Okay, thank you, Wendy. Mike, just looking for a response on that piece, and I want to look to other counselors who have their hand up as well and other questions.
So it goes back again to, where's the line, where's the policy development? Because you talk about federal and provincial funding and then saying, let's give our businesses a chance. Then you brought up, Meals on Wheels. What's to say that restaurants can't say that, hey, you guys are undercutting us and you're delivering food to community members. I want a chance to bid on that. So it's the exact same thing right across our organization.
It's not even close.
Okay, I have other speakers that I'd like to get to. I want to start with Sherry Lynn, Helen, and Audrey. Sherry Lynn, you have the floor.
Yeah, I agree with Councillor Johnson in a lot of cases, because I'm wondering where are we getting the staff to do this? Because I was told with some of my concerns that there's no staff right now. So I'm not sure with the concerns that are coming with the community when we're going to have time to be able to do this. So I think there's a lot of more stuff in public works could be doing than tree cutting.
Mike, I'll go back to Mike for a response, and I'm going to shift over to Helen, Audrey, and then Hazel. Mike?
So we're actually hiring people through Grand River Employment and Training to do this job. So we're actually creating employment within the community with this venture. And I've also heard the concern around, revenue, very, very minimal revenue that we're getting out of this, but I'm constantly faced with, different challenges around budgeting. And we are a deficit department running approximately a $2 million deficit that comes out of community funds per year just to operate. So this is something that really does help the community in the long run.
Okay, thank you, Mike. Helen.
Yeah, initially I was confused about the resolution, but in listening to Wendy, I could probably sit here and say the same thing about First Nations cable. Look what we're doing to First Nations cable. We're putting them out of business. So the same situation could apply there. I mean, like Mike said, it could go everywhere. And I'm confused with this resolution because I'm not really sure. Are we approving Hydro One or are we not approving Hydro One? Because it says to accept follow-up as information, but I don't see no follow-up. What are we accepting as information? What follow-up? Because I don't see. I'm confused with this resolution. Are we accepting Hydro One? I mean, the deal between Public Works and Hydro One, is that what we're doing with this? And it says, I don't know if I have the right one, but it says contract, accept the Hydro One contract follow-up is information. What does that mean? Am I looking at the right agenda? Because I don't know if this is the right one.
So a big part of that, Helen, is the fact that Hydro One had confirmed that they don't go through an open procurement process.
Yeah, Hydro One,
Hydro One gives the First Nation the first right of refusal, and if we refuse, then Hydro One does the work themselves.
Okay. So, what is that? What we're doing? Are we accepting Hydro Public Works to do this work? Is that what we're accepting?
Overseeing that.
Huh?
So we've already been approved to advance into the work, Helen, and sign the contracts, but this was just a follow-up as to the concern brought forward.
Okay. All right. Yeah, I read all the stuff, so I seen what Hydro One was saying, and I seen the different things. But yeah, we could apply the same thing to First Nations cable. Or Jeff might be going out of business.
Well, I think we should be cautious in our comments there because there's mistruths to some of that in relation to that specific project. So and
Well,
there's
we're not-
again that is on.
We have not
That is-
developed a partnership with First Nations Cable. We did not do that.
And we very much tried, Helen, and that's what I'm speaking to with facts. Audrey and then Hazel.
Just to add a little bit more clarity to this, at least I hope it's adding more clarity. The decision was made to allow Public Works to do the tree cutting prior to becoming aware of this individual asking to be considered for this. So that the timing of that is important to recognize. And I also took away from the last meeting that we were supposed to go and develop policy on this, so this wouldn't be happening to any other small business. That we were supposed to, if Darren's here, if he's on or his assistant, that we need to develop policy on that to assure people that there will be places to bid for jobs, and we have to get our policies in order to protect people as well as to make clear guidelines of who's responsible for what. So that's what I would like to follow up on and put in our action plan and to get that to our SAO and to start working on some policy for this for the whole council so that everybody knows what the rules of the game are right now and what they can apply for and what is, like, I think deep down, I believe that Mike and the Public Works did this out of the goodness of their heart because they know they're in a deficit as well as they're trying to take care of other departments at a minimal cost because everybody is stretched for dollars these days. So I appreciate what you did, Mike, and hopefully we can get some policy made so that it doesn't put any other small business in any kind of a conflict anymore. You know.
Okay, thank you, Audrey, for your comments. Hazel.
Yeah, I just wanted to make a comment too that from our BNI committee, we discussed this, and my understanding was that this was already in process before the complaint occurred. And I can understand why Mike engaged in a work contract with Hydro One. They wanted the clearing done, and Mike would be getting people to come in and work to do exactly that and give somebody employment. So I guess if you get 5 or 6 workers to come in and help clear cut, as opposed to giving it to one business, who's to say it's right or wrong? I think the summer student programs are coming on at great, and I think that's a good opportunity for a lot of the summer students to have employment throughout the summer. So I think I fail to see that it's a problem that Public Works has, done it this way. It's a good endeavor because it's going to provide employment for our own people again. So, and that's through Grand River Employment and Training. Thank you.
Okay, thank you, Hazel, for your comments as well. Wendy.
Yeah, I mean, not disrespecting anybody else, but the issue is while Public Works is going to employ people through Grand River Employment and Training, we are taking employment away from small businesses. So that leaves us at a ground zero. So it cancels one another out. And the whole issue is working together in partnership. And how can we do that so that we're not taking away, so we're not losing out, so our own businesses are not having to close doors, especially amid COVID. That's what we should be working towards. And I can't understand for the life of me why this is not a consideration of my colleagues and why we're not looking at it that way. Audrey's absolutely right. This went through, the contract went through, and we asked a lot of questions and we got responses. And then a community business approached and said, hey, wait a minute, because they read this in the paper. And I'm going to reference the email that we have in our correspondence. And it's between Public Works and it's between Hydro One. And the question is, or the statement from Public Works, no private business can approach Hydro One directly to bid on a First Nations brush clearing contract. The response from Hydro One is correct. However, the private business can approach the First Nations and work as a subcontractor to the First Nations. So there is an option. There is an opportunity. Why are we not doing that? That's my question. Why is that being ignored? When we can work together, there can be a partnership. It's a means to an end to get what we need. We can expand that service and provide even greater service. Capitalize on Ontario Works, the other programs that we have, and we can reach even more community members. It seems like a win-win to me. So I don't understand. And my very first question that I asked in this meeting, which hasn't been answered yet, is why did no one follow up with the business, the courtesy of a phone call, an email, to invite them to BNI, to have a conversation as per the general council meeting when this came up. And it was agreed to that would happen, and nobody did that. Not even the courtesy of a phone call. Why?
Okay, thank you. Looking to Mike for responses, because this falls under the purview of the Director of Public Works.
Yeah, so I'll go back over the video again, but this was my understanding of the issue, and I did when I come up through the committee, I did ask if what I had written and brought back addressed your concerns, the concerns that were brought to the table from the council meeting, and they were all in agreement that they felt like it addressed everything. So if it's a matter of a phone call, I'm happy to make that, and if the company wants to come to the BNI committee, I'm happy to facilitate that.
But and just in further follow up to Wendy's comments, I think it's also like I see both sides of what's being discussed here, and I do see also in a win-win situation, even with our internet project that Helen had referred to. We are looking to work with community to come up with a response and a plan to address the needs. So and I don't want to get too much off topic, but the internet in itself right now is a pandemic response. Everyone is reliant now on internet. So we want to work with everyone. We want to work with Jeff's Cable. We want to work so that it has, again, that overall community impact and benefit. So I do see Wendy's point in a sense of why can't we just include that piece as part of the clause in the resolution? To me, that's a simple fix. Is it not? Or is there opposition, Mike?
So part of what our intent is with this contract is we're going to do the clearing contract as our number one priority because that's our contractual obligation. We also have to do roadside clearing. That's something we've talked about great lengths here about our roads and the condition that they're in, and just they're short-staffed, right? So one of the big issues is dangerous overhanging limbs or dead or dying trees within road allowance. It could pose a hazard. So that's going to be, basically priority number 2 for this team of people. And then priority number 3 will be the community as far as cutting, trimming on private property for those who would qualify. Let's say, and it's right in the briefing note there, let's say one of the services has an elder that they get a request from for assistance on their private property. However, maybe our departments don't have that capacity built so that they can turn to us, and we can try to help in some way, shape, or form. So those are really our top 3 priorities. And again, it's all around community benefit. Whereas if you tender this out, based on here, I want you to complete this hydro contract. You don't get the benefits of 2 and 3. And who's to say that a local company would even win if we're tendering it out publicly?
Okay, thanks, Mike, for your response. Wendy.
Yeah, thanks, Mark, for your attempt to get some sort of compromise and reason with this, because I can't fathom why this is going the way that it is. There seems like there's huge reluctance and huge resistance, and I don't know what the issue is. I hear what you say, Mike, but why are we reinventing the wheel? if there's a company that's already out there doing this work, why wouldn't we try and figure out a plan to work with them? And maybe there's an offside of something that they don't do that Public Works could do, because if Public Works is lacking and you've got all the time to do all of these projects, then, you know, I guess it almost looks like we're looking for work here. So if that's the case, then do something outside. But if we've got companies, and to your last point, who knows if, you know, a local company would get the bid. What I would hope that we would reach out to our local companies first. I mean, we do too much of going outside of our local companies. I mean, that's who we're paying our millions and millions of dollars and all the change orders. And that's probably why Public Works is in the $2 million deficit, because all of the work and going back and redoing and all of those things. So, you know, I'm still not understanding where the reluctance is from the B&I committee and from Public Works to at least try and engage and see if there's a reasonable solution with this company and other companies to find out if there's a workable solution. Like, I just don't get that.
Okay, thank you, Wendy. I do see a number of hands being raised as well. Again, council trying to come to common ground and where we can all agree to this, because again, to me it's a simple fix. I mean, I don't know why we can't just include that piece, regardless of which priority it falls under, to include that piece as a clause within what we're going to be passing. Wendy, and then over to Darren and Sherry Lynn. I mean, sorry, Michelle. Michelle, Darren, Sherry Lynn. It's on your, my screen's messed up.
So Mike, are you staffed up? If not, in the interim, I would say, and we've talked about this at B&I, using the community company. Also, I think there's two parts of the contract. So if you do, you will be clear cutting, right? So, I mean, I think it is a win-win. And that's what I came out of B&I meeting with. So it might not be written as such, but I do think it wasn't the intent of B&I to, you know, not look at our community businesses. And so I'm just wondering, are you ready to go with this contract?
Yeah, we're beginning to staff up. So we have those, we've been in touch with Great to find people, and we are preparing. I'm not sure exactly where it stands at this point in time, but we are proceeding on the original path that we were approved to proceed on.
So that might come in the fall time. So in the interim, you could actually utilize the community business to get the work done, right? Like that's the meme I guess I'm trying to share.
I mean, like if we're not going to take this on and we're going to outsource it, then shouldn't we give everyone an equal opportunity to bid on it? So it'd be an RFP process, right? But if you go an RFP process, our tendering policy says I got to get at least 3 quotes. So if I get 2 local and 1 non-local and non-local wins, then again, there's going to be an issue. So I'm just trying to understand what's being. Do you want me to negotiate directly with this company because they're the ones that brought it up? And is that fair to other companies if we are going to outsource it?
Mark, it's Hazel.
Yeah, I have a speakers list going. I'm going to go to over to Darren, Sherry Lynn, and then Hazel.
Okay, I'm going to talk a little bit broader. I mean, I appreciate the conversation that Michelle and Mike just had, and I think we're trying to get to a compromise solution and how do we move forward in the most positive way. And I'm taking everybody's comments. I see everybody's valid points. I think the issue here is, and I talked to the chief about this earlier in terms of our organizational review, is when we moved everything over to the development corporation, we moved everything over, and we didn't leave an economic sector under council. That's what's been missing. That's our big gap. And what that means is an inventory of qualified vendors or businesses within the community to bid on projects. We haven't, and that's not anybody's fault. That's just what's happened. So that's a big gap, and that we need to address that. And beyond that is a plan. Like if we know that the tree cutting is going to happen this year, and we know it's going to happen next year, we can provide notice to those qualified vendors that can provide the services. And that's just something hasn't been done. I mean, you know, we've made some decisions as a community, as a leadership. Previous councils have made decisions which were good decisions, but they weren't fulsome. So now we're dealing with filling those gaps. And I think that that's what we're doing. And that's what we're attempting to do. And we're doing it as best we can. I think there's always a way to be professional and respectful of stumbles along the way. And that's basically what we're talking about here, is a little stumble. I don't see it as a major catastrophe. I see it as a way of communicating. Yes, absolutely communicating to the business community, not just this particular business, but the business community in general, that we need to make good on this. And here's how we're going to do it. That's part of our strategic plan. That's part of being, a complete society, a complete community. So, without getting too touchy-feely about this, this is hard-nosed work, and we haven't done it. So I think we're heading in the right path. There's a lot of things happening concurrently right now. This is just symptomatic of the issue. This is, and I'm not trying to minimize it. I'm a businessman. Everybody knows that. I've been a business supporter right from day one. So I absolutely think that professional courtesy should be extended, but it's a stumble, and we will make it right in the future. I think that's the key. And just one point on the First Nations cable, we did invite them. They were completely open to the table. We wanted to work with them, and they chose not to. They chose a different strategy, and that's a prerogative. It's every business's prerogative to choose a different strategy. It's a business strategy. It's a political strategy. But all we can do is be open and receptive to those that are qualified to do the work and have the resources to do the work. We can help them get the resources as well. So if the rules are the rules, it's our job to bend the rules or change the rules, because we can't just keep delivering programs as per rules. We need to develop our own plan, and that's the part where we've been spending too much time delivering other people's programs, and that's where we got to shift. I know, Chief, you and I have had many conversations about this, and I'm glad to see that we're kind of getting to that point where it's actually, because of the pandemic, to be quite frank, it's kind of forced us into this position. So I think there's some good coming out of it. That's a silver lining. I guess part of it is we don't have an economic sector within council. We need that. That's where you're going to have acknowledgement, receptivity, and inventory of qualified businesses in the community that can deliver on certain project scale. We don't have that. Other communities I've worked with have that, and that's not a criticism. It's just the way we've gone. We thought we'd just park everything under the development corporation, and that's not it. That's just a piece of it. That's the business development. That's not the economy. And I've heard that, Councillor Johnson, many people have talked about the economy. That's the part that we're missing. I did a lot of work as a consultant on economic leakage, labor force. We've touched on all these things in this conversation, but we haven't brought it back to, well, how do we serve that? And that's our job, right? We're serving. So how do we put in the tools, I'll call them sectors, not departments, because I want to switch our language from departments to sectors to serve the whole economy and get more full. So I just want to make some comments, high level, of course, but I'm hearing everybody's comments. I'm making notes. Yes, there's policy implications, there's policy needs, there's policy gaps, but we have a big gap. And I think we have some meetings coming up shortly to talk about this further. So I think it's really good conversation. This is maybe a small example, but it's also it's very transferable to other stress points that we're facing. So I just wanted to bring that forward and just speak candidly about it. With community listening, I think it's important that they realize that we know this, that we're working towards fixing it. I'll just stop there. I could keep talking, but I'll just stop there.
Okay, thank you, Darren, for your good words. I do have a speaking list. I'm gonna go next to Sherry Lynn.
And then me, Chief.
I'm good. It was answered. Thank you.
Okay, Hazel's next.
I'm just going to pass, Mark. Thank you.
Okay, thank you. Carrie, and then Wendy.
Yeah, this question is probably to Mike. Mike, what would the liability coverage would have to be for any third party, like to sub anything out, any job out that would require cutting along hydro lines and road allowance?
I think that'd be go back to Darren's point. So Darren made a lot of great points, and it's in the briefing note there in regards to, you know, connecting our business registration system with an overall vendor list that everyone can access. So I think, again, it's symptomatic, but that would go back to making sure the company is properly insured with WSIB and has a proper insurance coverage, right? So that would go all into that process.
Mhm. Okay.
Okay, thank you, Carrie and Mike. Back over to Wendy.
Yeah, to answer your question further, Carrie, I mean, it is up to the business to have their own liability, and it depends on the job that they're bidding of what the level of that liability, but there is minimum requirements, at least 2 million, and then up. So it is up to the company. I guess I'll go back to Mike's earlier question on what we want him to do. I'm simply coming forward with, yes, we passed a motion. Yes, there's a contract going through, but can we not, I don't see how it's too late to try and work this out or to get some sort of a compromise. I mean, number one, why can Mike and BNI not reach out to the business and have a discussion with them and say, is there an opportunity? Maybe there is a win-win. Maybe there is a compromise, or maybe after a discussion, the company says, no, we can't do that. That is outside of our scope. But as a courtesy, number one, have the conversation. I mean, a month has gone by. There was ample time to do that. So maybe that's the first step, is have that simple conversation. And maybe there is something that's been overlooked and there's that opportunity. And if it's a tender process, I mean, why can't we do first right of a refusal to our own companies? And maybe there's another company in the community. I don't know. But absolutely, fairness and policy has to be followed. But I think we should be, you know, giving that to our own community rather than going outside. So, I mean, that's the first step, is having that conversation with them, at least doing that. And it's not started, so there's still an openness. Because I'm hearing Michelle say one thing, I'm hearing Mike say something completely different, that it's no, it's done, it's moving forward, and there's no opportunity. Yet Michelle is saying that BNI discussed something different. So that's all I'm asking. This is my last comment, and you know.
Okay, Council. So we've had thorough discussion on this motion. There again, it's good conversation, and Darren, thank you for highlighting those really high level points, because you know, all of this work, again, we can't recognize that everything is going to get fixed overnight, and not also saying that everything is entirely broken. But it's a matter of efficiencies and productivity, and that's what really our goal is to get on a path so that we have a plan of action and we can implement it. And that's really the purpose of, I guess, more the broader discussion. But in specific to this motion, I'd like to know how council would like to proceed. Audrey?
I think Mike made a good recommendation. He said that he would call the gentleman. He said that he would invite that gentleman to BNI. And I think that's a good compromise. And then we have the discussion to see exactly what this person can do, and if there is a chance that there's a availability for one of those three sections. But we have to sit down and talk in order to do that. That's my suggestion.
Okay, thank you, Audrey. So again, it's been moved and seconded already in relation to the motion. So is there any further comments or from yourself, Mike, in terms of the compromising piece of where we can go from this point?
No, I really appreciate everyone's points, and I really appreciate the discussion, because again, my intention was just to find, you know, where the line was between developing capacity and then outsourcing, and you know, definitely want to respect it and play within those rules. But you know, again, we if I'm going to contact this one business and talk to them about, you know, how can you fit, you know, I definitely see the compromising piece, but it just and I'm happy to do that. But the only thing is that I know that there's other companies in the community that would probably want a bid as well. A6N, I think, comes to mind as far as tree cutting. And I'm not, there might be another one too, but I'm happy to touch base with all of them if council would like.
Go to tender.
Okay. Okay, thank you. Thank you for that, Mike. Looking to then, I want to draw this to vote very soon. If you're not happy with the motion, then I'm looking to see if you're opposed. But nonetheless, I want to come up with a compromise. That's the goal of this. Obviously, we all want to support, small businesses. We have in the past. We continue to do so, especially with our small business relief fund that we've now going to be doing it for the second time. So it's evident that this council continues to support small businesses. So nonetheless, it's about working together. And I think that's the biggest point, is how we do that and respectfully do that. Wendy, then over to Helen.
Yeah, just to Audrey's comments, would the motion have to be changed slightly because it's not accepting as information? It's actually for the BNI to set up a meeting. I mean, I think that's all Audrey was talking about, is to have that discussion moving forward. And then I think BNI could make a decision after that, after having that discussion. So could the motion be changed slightly just to reference that meeting with BNI? And I'm not suggesting that it be given to anyone. I'm just having that discussion. And I think Audrey laid it out very well.
Okay, thank you for that, Wendy. Just before I check in with Helen, looking to the mover, Audrey, and seconder, if you're willing to change and include that piece and remove the as information part.
I think remove the information part, but I think it has to go out to tender. Maybe just on our community. Especially if there are more than just one tree cutting place, and it shows favoritism.
So even just conversations to have, I don't understand why we can't even just say have a conversation to bring them all in, then, if that's the case. Like I don't understand what we're. Okay, so looking to the mover in seconder, again, it's been moved and seconded, is Helen had her hand up.
That was going to be my comment. If we're going to be, if Mike's going to be bringing in one, he has to bring them in, bring all of them in. You can't disfavor one over all the rest.
Yeah.
And they're just going to talk.
I agree.
We're not putting out no tenders or nothing. They're just going to talk about it, because this, to me, this is already done.
Exactly. And that's exactly what I think the purpose of the amendment to the resolution is. If that's the case, then bring them all in, have a conversation, and see where it goes. Hazel?
I was just thinking the same thing, that it should go to tender, because that's the process. We spent quite a bit of time talking about this now. And in all fairness to everyone, tendering is the way to go now.
Okay, thank you, Hazel. So again, there's a motion on the floor. It's been moved and seconded. Looking to the mover and seconder on that one resolution piece. So are we agreeing to bring them all in at the BNI? Not necessarily, or are we saying to go to tender? That's what I'm now confused with, because last I knew it was just a small adjustment to bring in them all, if that one for all, to have a discussion at BNI over this piece.
I think bring them all and have a discussion, because some of them may not even want to bid on it. It's such a small number to somebody who's a big company, but invite them all and let them have free will.
I agree. So are you willing to include that within the motion, Audrey?
I am. Everybody's
okay.
happy.
Thank you, Audrey. Seconder, are you willing to agree to that?
No, I'll withdraw my seconding of that motion, because I think it should go to tender. So I'll withdraw my seconding of it.
Okay, is there a new seconder to the motion with the one change to include all, to have a discussion at BNI? Is there a seconder?
Question.
Second by Helen.
Question first. It's only
Helen.
to have Mike. It's only to have Mike discuss with these different companies. We're not going to a tender process or nothing. As far as I'm concerned, the decision has already been made. And that's for Public Works to do this, whatever they're doing. So I'll second it as long as it's only have conversation.
That was the purpose, yes.
All
It's
right.
been moved. Audrey, second. Helen, further questions or comments? Wendy?
Sorry, so the conversation isn't just with Mike though. The conversation is with BNI, right?
That's correct.
Yeah. Okay, thank you.
Somebody,
Okay, I see our secretary has her hand up. Shirley.
Okay, so I just want to be clear with this motion then, that the motion is actually to read that the potential individuals be invited to the next BNI to discuss this contract. Correct? Mover, seconder?
Yes.
I don't think it's to discuss the contract.
It's not, it's,
Okay.
council,
well-
we're getting a little lost. Sorry, Shirley, can you just repeat?
Okay, so my understanding is that basically all you want is to have these group of people to the next BNI meeting.
Yes, to have the conversation.
Okay,
To talk.
just wanted to make sure.
Melba?
Okay, thank you, Shirley. It's been moved and seconded. Further questions or comments, Melba?
Yes. I think it goes beyond just a conversation. Aren't we talking about qualified vendors? Are we going to question them of their work and their past experience and how many staff they have? And we're talking a lot of danger and risks here if people are not qualified to do this kind of work. I'd be concerned of the liability myself that would possibly be on council.
Well, we're talking people who are in business of this, right? This business venture. It's not like we're just talking to have community members come and have a conversation to do this work. These are people who are in business and understand the liability of being in that business. Are there any further questions or comments?
Thank you.
I just want one comment.
Sure, go ahead, Helen.
Well, this isn't the first time this comes up about using local business. It's been coming up for years and years and years. And one of the biggest issues is local business doesn't have the insurance. They can't be bonded. They don't have the money to do that. And you have to be bonded and have the insurance to do any kind of a project. It's been coming up for years, ever since I've been sitting here. The same issue. We want to work with local business. They can't be bonded and they don't have the money for the insurance. Half of them aren't doing workers' comp, stuff like that. So there's a lot of issues that go with it. It's not just a matter of saying, okay, let's get this company because it's local and they know how to do it. And I'm sure at BNI, you'll have that conversation about those different issues that we've experienced over and over and over and over. I just remember so many companies coming to council and complaining because they're not getting none of the work. But it doesn't fit.
Yeah.
So.
Okay, thank you. Thank you again. Valid points and really ultimately still good conversations. I think at the end, what I'm seeing and learning through just this conversation is we need to work more collaboratively in partnerships with community in general across the board. When we're working on projects or certain things, we just need to work better together. I don't understand why it's so hard to do that. Audrey?
I'd also like to make sure that we welcome our SAO to come and join us at the next BNI meeting too, please.
Most definitely. Darren?
I'll be there, Audrey. You know it. Back from vacation, I'll be there.
Okay, great. Thank you. Thank you for that, Darren. Okay, council, is there any further questions or comments in relation to the motion? Seeing or hearing none, all in favor? Any opposed?
I'm opposed, Hazel.
One opposed, Councillor Hazel Johnson. Motion's carried. Okay, Mike, is there anything further on your end?
I do know Councillor Michelle did add a new business item.
Oh, that's correct. Maybe if we can just really quickly, so we don't have too much time or too much left on the agenda. So if we could just maybe go really quickly to your agenda item, Michelle.
So
I'll just jump ahead really quickly.
Oh, sorry. Thanks, Mike, for bringing this forward now. A few weeks ago, I had a community member call, and she had some vehicle damage after going through Cuga Road. I've actually sent it to Mike, and Mike, shared with me the process in which I in turn shared to her. Since then, though, she has gone to get her vehicle serviced, and she did have damage. So at what point, so does this go now to administration to look at and work with Mississaugas of the Credit? Or what is the policy on our roads when damage is done?
So our procedure and policy around damage caused to vehicles by condition of the roads is we go through insurance. So they go through their insurance, we give them our insurer's information, and they go through that piece. I know that we've discussed this with the Credit First Nation, just because that's a lot of the damage was sustained as a result of the road work that they were doing as far as cross culvert replacement between Second and First on Cuga Road. And I do know you've initiated those conversations, Michelle. So I'm happy to follow up with their director of public works over there to see exactly what will happen. But I know I was kind of I was hoping to get because you said you were going to get some kind of damage report done on the vehicle or an inspection. So if we can get a copy of that as well, just so that I could share that.
She sent it to me, I think, on Saturday. And so, okay, so you just went through the process because our roads are quite terrible. And so if somebody actually blew a tire through hitting a pothole, they would still have to go through insurance, is what you're saying.
That's correct, yes.
So outside communities would actually pay for that. That's my understanding, right?
I'm not entirely sure what outside communities do, but the reason we put those measures in place is because there's really no mechanism for us to prove that that damage was sustained on our roads. So really, if I got a windshield chip over in, Brant County, I would just call Six Nations Public Works and say, hey, I was going down 6 line. I got the stone chip. You need to replace it. And then that drives up our deficit.
Okay, thanks, Mike.
Okay, thank you. Thank you for that, Mike, and for bringing that forward, Michelle. Is there any further questions or comments? Okay, that being said, thank you. I believe that's everything on the agenda, Mike, for you, not unless you are joining us in camera, but just want to say thank you for joining us.
Yeah, thank you, everybody. Go Leafs, go.
Yeah, sure.
Take care, Mike.
Yeah, you too. Thanks.
Okay, Council, that leads us into our next item on the agenda, which is scheduling. So obviously we are in General Council currently. Tomorrow morning is Environment, following Political Liaison on the 31st, beginning at 9 a.m. into Human Services on Wednesday, and then following up with General Finance on the 7th of June. So we do have a number of other meetings scheduled as well. So I just want to confirm that you have those pieces in your agendas. The other piece that I just really have for quick updates is we've been attending, obviously, we have 2 important, I think, elections coming up. We've just, I'm not sure if you have seen, but our current regional chief has made her announcement this afternoon that she is running for national chief. So that's Roseanne Archibald running for national chief. So I still have not heard, or I'm not sure if any of you have heard any candidates for Ontario regional chief. But again, I think we have 2 really key elections coming up. I think that's really going to really help determine our pathway forward and our advocacy and relationships and so forth. So just wanted to bring up that piece. I have been attending, along with Christopher on the line, the Leadership Council meetings, which we've been, again, discussing multiple issues. One of the areas that we touched on last week, but I brought this forward as well, but is in relation to that prosperity table that I had mentioned, in that there were 3 areas within that prosperity table, which is basically the economic recovery plan that Ford announced. And those 3 areas are: 1, First Nation capacity building projects for economic development. The second area is a fund for entrepreneurs, so whether that be equity funding, grants, interest-free loans, and so forth. And then the third area is larger projects, so in the industry, in manufacturing. So those are the three key areas that we want to get ahead. I've been having conversations around some of the other areas that we've been dealing with in relation to banking. I don't want to get into the specifics of banking issues in its entirety, but have been conversing with other chiefs. We've met with one of the directors at Chiefs of Ontario last week to start and put forward a resolution that we'll be bringing forward to council as well to the AOCC for all of the Ontario chiefs to have a discussion and hopefully pass so that we can then move it right up to the national level. So that's just the other piece I wanted to mention as well is in relation to Bill C-15. I know we need to do some more what our true position is on that and where we want to go. I think there needs to be some more advocacy in terms of you know, are we agreeing? Are we not agreeing? I know we've made a statement in relation with the AIAI. So you know, those are some of the pieces that I want to get to some more discussion and conversation on, as well as even just further our strategy session. So I know we've already had one first strategy session, you know, that we wanted to take back and look to see what we've heard from the discussion there. But really the goal is to look to, you know, as we approach the midterm of our term, is to really come into where we're going over these next 2 years and what can be accomplished in these next 2 years with the time frame. So, you know, recognizing basically the small, medium, and kind of bigger items, you know, that obviously we're not going to solve or fix everything within 2.5 years, but really having you know, what is the reality and what is our pathway forward in terms of our political work plan and where we want to go. Just if I can really quickly, I see Sherilyn had her hand up.
Yeah, also too, to keep on the radar, that distinction-based Indigenous health legislation.
Yeah, there's even the other, yeah, there's a few that's a big piece that we need to keep an eye on. I think the other area too is in the, oh, sorry, go ahead, Sherilyn.
Yeah, because there's really nothing. They're just wanting to pass it through. There's really no meat and potatoes to it.
Exactly. And I think just a few of the other, even with within the Justice Department as well, looking again to have conversations there and how we can re-mandate the Justice Department in itself, because there's a lot of things happening in justice in its entirety, especially even with Lameti's response. So I know we have a few special counsels coming up in relation to even gaming, for example. You know, where does this community want to go with that sector or file, rather, whatever we're going to be calling it. But nonetheless, you know, having these conversations of where we want to go in these different files. So a lot of these pieces, again, is ongoing work, but you know, our goal is to put all of this on paper and present it to full council, obviously, have further conversation, deliberation, and be able to give it to community to see where and show community where we're going in these next 2.5 years. So that's really the plan and where what we've been discussing. Not sure if there's any questions or comments. And again, these are just really quick verbal political updates. We'll have more information again as we bring continue bringing these issues forward. Okay, that being said, we have no other new business. We dealt with Michelle's new business item. I will then look to a motion to adjourn to in camera. Moved by Michelle, second by Audrey. All in favor? Any opposed? Seeing or hearing none, motion's carried. Thank you for joining us this evening and looking forward to our next Facebook Live session.